welcome back to Rosie the Riveting RN. I am Professor Poole. I am here today to help you learn about calcium and phosphorus, those awesome electrolytes that everybody just really loves to learn about. So I'm here today to hopefully help you learn a little bit more about the calcium and phosphate ions and how they affect our body, why we need them, and what we do when there's too much or too little of it. So hopefully I can really condense the information, make it a little bit more understandable, and hopefully help you apply what you're being taught in school today. So let's get into it. So calcium and phosphorus, they are electrolytes in the body. And why do we need to have calcium? Calcium is really good to maintain the structure of our bone and teeth, but it's also really good for muscle contraction. So keep that in mind. Also, it is really good for clotting. So calcium, contraction, calcium, clotting, those C's go together. And then phosphate, why do we need phosphate? Well, we need it for ATP synthesis. We need it for red blood cell formation and function, FXN, that's shorthand for function. We need it for glucose uptake as well as the metabolism of our macros. That's going to be your fats, proteins, as well as carbohydrates. Now, what's very unique about these two electrolytes is the fact that they are regulated by the parathyroid gland. These are the only two electrolytes that are regulated by the endocrine system, so that's something to really keep in mind. Also, what is very interesting and unique about these is that there is a complete seesaw effect of these. Now, what does that mean? Now, when calcium is low, phosphate or phosphorus, we use them interchangeably, it's going to be high every single time. And then when phosphorus is low, calcium is going to be high every single time. Now, I know that there is an inverse relationship between sodium and chloride, or sodium and potassium, but it is physically impossible for these two to both be low or both be high. It is still possible for potassium and sodium to still be high or low at the same time. There's just certain situations that can happen with. With this, it is physically impossible because it is regulated by the parathyroid hormone. So let's get into our signs, symptoms, causes, all of that. We'll start with calcium first. What are the typical causes of high amounts of calcium? That is known as hypercalcemia, right? High amounts of calcium in the blood. It's going to be because the parathyroid gland is very overactive for one reason or another. It's just overworking. Also, certain cancers, breast, bone, you name it, there's a number of cancers that can actually cause you to have high amounts of calcium in the blood. Thiazide diuretics, it's not a very common reason. It is rare, but sometimes that does happen. Also, immobilization, like prolonged immobilization. Now, this happens because your bones start to break down when you're immobilized for an extended period of time. And what's in the bone? Well, it's going to be your calcium. It's going to be seeping into the blood, increasing the blood's concentration of your calcium. Also, any calcium containing medications, that is going to be the reason why you have high amounts of calcium. Calcium-containing antacids is what I was supposed to say. Now, your signs and symptoms, you have that high heart rate, that high blood pressure. You can have dysrhythmias. You can have really weak, deep tendon reflexes, right? You try to do those deep tendon reflexes, and it's just no go. You have weakness, confusion, also kidney stones. So that's an interesting thing. So kidney stones can definitely cause you to have calcium, because think of your blood vessels as pipes, right? And the water is blood, right? So you have pipes, and there's high amounts of calcium in the pipe, or in the water, right? And it gets calcium buildup. Now what happens? Well, you get those little stones and those calcified buildups built up in the pipes. Well, same thing with your blood vessels and your kidneys. You have a high amount of calcium built up in the blood. It gets filtered through the kidneys, causing you to have kidney stones. Also, same reason why you have high blood pressure and high heart rate with high calcium. You have like calcification in the blood vessels, making those passages narrow, increasing the blood pressure and increasing the work from heart. So kind of tips and tricks to keep that a little bit easier to remember. So now you know the causes, the signs and symptoms, and so how are we going to treat it? So mild or asymptomatic patients, what we're going to do, we're going to stop any medications that are causing the problem. If it's thiazide medications, we're stopping those. If it's calcium containing antacids like Tums, well, guess what? You're going to stop it. And we're going to decrease or restrict the amount of calcium you're taking in. Now, it's good to know we're not completely eliminating it, and there's a reason, and I'll get to that in just a minute. So you're going to be decreasing the amount of calcium intake in your diet. Also, what we're going to do, we're going to increase your fluid intake to 3 to 4 liters a day. That is the same as 3,000 to 4,000 milliliters a day. Now, the reason why we want to do that is because we want to prevent that formation of kidney stones. So we want to make sure that the fluid is flushing through, keeping those kidneys nice and patent, and we're peeing out that high amount of calcium, basically. Now, if you are severe, you do have cardiac dysrhythmias, you're very symptomatic, you're really weak, confused, what we're going to do, we're going to do calcitonin. We're going to give you calcitonin to keep the calcium into the cells or back into the bone so that it decreases the concentration of calcium in the blood. So what do we do to assess if a patient has high or low electrolytes in anything, right? It's a blood draw. So we're looking at the concentration of the blood of that specific electrolyte. So what happens is there's a high amount of calcium in the blood, therefore we need to decrease that. We're going to do that by either increasing your fluids, decreasing your food intake that has calcium in it. We're going to stop medications that are causing the problem. We're going to give you fluids to flush it out, right? And we might even give you calcitonin to take that calcium ion that's floating around in your blood and put it back into the cells or even the bone. Keep it in. We can also do IV fluids, that's that IVF, and what's very gold standard is bisphosphonates. Bisphosphonates, right? It has phosphate, basically, kind of in the medication class term, because calcium and phosphate are they have that direct seesaw effect. And then lastly, if you're really bad, you're really symptomatic, we're gonna get you into dialysis ASAP, and we're gonna filter out that high amount of potassium. Now let's get into hypocalcemia. Now, reasons why you can be hypocalcemic is because your parathyroid hormone is not functioning appropriately. There's some sort of deficiency that is going on. Also, what is very interesting with hypocalcemia is that it can be caused by multiple blood transfusions. Now, that has to do with a preservative called citrate that's in the blood products to make sure that they don't clot in the bag. And if you have too much of those, it can actually cause you to have too little calcium in your blood. Also, if you have very low calcium intake, or if there's a fluid shift, like your calcium was in the blood and now it's shifted into the intracellular fluid, it's going to drop your concentration of calcium. So what are your signs and symptoms? Your signs and symptoms are going to be what I call the C and the T. The Chavoxic sign, where you tap the cheek, the C, and you have the that muscle contraction, the Cheboksuk sign, or you have trousseau's. Trousseau's is where you do the inflation of the blood pressure cuff, and within 3 minutes, that wrist is going to be really tight in that deep tendon reflex right in the wrist and cause the T. Now, I teach my students to kind of think of that movie Dodgeball. You know, when Ben Stiller comes out into the dodgeball arena and he's doing his, like, you know, his little thing with his teammates, and he goes whoop whoop, right, because of the cobras, right? Because remember, that's the T's, makes that T sound when they do that. Kind of dumb, but whatever, it helps you remember, So it causes the C and the T, dysrhythmias, low blood pressure, low heart rate, tetany, seizures, deep tendon reflexes, which is why you have those muscle contractions and the tendon in the wrist tightens up, and also laryngeal stridor. That is a medical emergency if you start to hear that laryngeal stridor sound. Now, how do we treat this? Mild or asymptomatic, we're just going to increase your calcium intake on your diet. We can also do calcium supplements. We're going to divide them into 2 different doses a day, and every single dose is going to be paired with vitamin D. Now, the reason why we do that is because vitamin D helps absorb calcium in the GI tract. Also, what we're going to do, if it is symptomatic, you start to have that low blood pressure, low heart rate, you become really contracted in your muscles, you have that laryngeal stridor. We're going to give you calcium glutamate. We're going to give you IV calcium glutamate, which is basically IV calcium in the blood, increasing the concentration of the blood's calcium level. Also, what we can do thiazide diuretics, help you hold on to that calcium in your body. Maybe you're peeing too much out, thiazide is going to restrict that loss through the urine. Also, we can do is breathe in a paper bag. Oddly enough, respiratory acidosis actually causes, or alkalosis, respiratory alkalosis causes you to have low calcium levels. So we give you a paper bag to breathe in, to rebreathe that CO2 so that it levels that out, and then that's how you treat that. So basically what you're doing, you're treating the underlying cause of your hypocalcemia. Now let's dive into high phosphate. High phosphate, what is going to cause high phosphate? It's going to be an acute kidney injury, chronic kidney disease, or you have phosphate-containing laxatives, right? You have lots of those, and that's going to increase that concentration, or if your PTH is very deficient. So let's get into hyperphosphate. So you can be high in phosphate for a number of reasons. One of those is going to be an acute kidney injury, also known as AKI, CKD, which is chronic kidney disease. It can be because you're taking too many phosphate-containing laxatives, or your parathyroid hormone is deficient. It's going to cause you to have high phosphate. Now, kind of the same thing. So hyperphosphatemia is going to look the same as low calcium. Low phosphate looks the same as high calcium because they have that seesaw effect. Now, what are your signs and symptoms of hyperphosphatemia? It's going to be the same as low calcium because of that seesaw effect. Plus, you can have organ dysfunction and it can lead to renal failure. Now, what is your treatment? Your treatment is going to be restricting high phosphate foods, which is dairy. Now, you're restricting them. You're not completely cutting them out. The reason why you would do this is because dairy has a pretty good amount of phosphate in it, but it also has a good amount of calcium too. So we're not going to completely kick dairy to the curb, right? Because you do need to have that calcium intake while also taking down that phosphate. So because they are a seesaw effect, we're not going to completely kick dairy to the curb because it has calcium in it. We're just going to limit it because we already know, okay, well, dairy has phosphate, but it also has calcium. So we're going to give you just a little bit. We're not going to kick it to the curb completely. This way, we can lower your phosphate while safely also increasing your calcium as well. Now we're going to give you calcium binding agents. This sometimes throws my students through a loop because they're like, well, we're giving phosphate, but we're giving phosphate binding agents. Phosphate binding agents is something like calcium carbonate. Basically, this is a medication that we give you, and this is going to attract excess phosphate so that it binds to the calcium carbonate and you pee it out, poop it out, whatever. You just get rid of it. So basically, we're giving you calcium carbonate, which is a phosphate binding agent. It's like a magnet specifically for phosphate, attracts the phosphate, and you excrete it out, just like that. We can also do IV fluids, that IVF, it's that same as IV fluids. And then we can also do loop diuretics as well. And then we can, of course, do dialysis if you're very elevated in your phosphate and you're very symptomatic, you're one sick puppy, we're going to do hemodialysis. Now let's move over to hypophosphatemia. Now, why would you be low in your phosphate? You're low in your phosphate because your GI system is probably not absorbing the nutrient phosphate well enough, right? So you're not getting it. You can be eating it till the cow comes home, your GI system's not absorbing it. Other reasons because your kidneys are peeing it out, or you just don't have enough in your diet. Other reasons because there could be a fluid shift. Maybe there was a good amount of phosphate in the blood, and for one reason or another, there was a shift, and that phosphate went from the blood into the cell, decreasing the blood's concentration of phosphate, and that can be why. So your signs and symptoms of hypophosphatemia are the same signs and symptoms as hypercalcemia. Other things that you're going to see is possibly anemia because the red blood cells can't, they're functioning improperly because you do need phosphate for red blood cell function, and it decreases that oxygen transportation. You're going to have fatigue, rickets, or osteomalacia, which is basically rickets, but in adults. Now, you know your signs and symptoms, you know the causes. Now, what do we do with that? How are you going to help the patient? Mild, moderate, low phosphatemia, that is going to be increasing the intake of phosphorus, or, we give you supplements, right? If it's very severe, we're going to give you IV form of IV sodium phosphorus or IV potassium phosphorus. And then lastly, what we're going to do, we're going to monitor phosphate and calcium lab levels every 6 to 12 hours. The reason why we want to do that is because, again, of that seesaw effect, we want to increase that phosphate level and safely decrease that calcium level, because we don't want to have any adverse effects and we don't want to cause any organ damage or any type of severe damage in the patient. So that is your down and dirty, basically, of phosphate and calcium. I hope you enjoyed being here. Thank you so much for stopping by this channel. Please like, rate, subscribe. Please let me know if there's any other topic that you want me to cover. Please tell your friends, share this with your friends. I greatly appreciate it. And you guys have a good night. And remember, the best medication is patient education. Bye-bye.